Hi, I'm Sergeant Travis Jacobson with the Grand Forks Police Department. I became a certified DRE in 2004. We're here today to talk to you about some questions regarding synthetic drug use. A synthetic drug is anything, any drug, I guess you could say, that is made in a laboratory setting. There are a lot of drugs that are used in the world of medicine that are actually made in a lab. However, I think a lot of what we're running into with these synthetic drugs that we've been seeing on the street, that's the problem with it. A lot of them are made in someone's house or basement, and they're not the right mixture as far as what it would be in a lab. And unfortunately, what happens sometimes is, let's say someone uses a synthetic drug and then their friend sees it, and then maybe they had what they would call a good trip, and then they try it themselves, and it doesn't react the same with them, so they have a bad trip or possibly even death. And that's what's happening, I think, is people are just willing to try it because they've heard about it, but it could be lethal for that individual. I would say the most common synthetic drug right now that we're seeing in Grand Forks is your synthetic marijuanas. The synthetic marijuana looks almost like real marijuana, kind of a green leafy substance. It's pretty much potpourri, and then what they do is when they get the synthetic compound, which can be liquid form, powder form, oil form, they actually will spray it on or soak it into this potpourri type mixture, and then the only reason there's potpourri is so they can actually roll a joint and there's something to burn. So the synthetic marijuana looks very similar to the real marijuana. The bath salts, there are many manufacturers of this as well, but what this looks like is pretty much a kind of a really fine table salt, or pretty much a bath salt. I mean, I know there are some bath salts out there that are legitimate, and it's just a real fine crystal. That's what that would look like. And then with like some of the other things we've been seeing as far as the synthetic LSD or things like that, this could be pretty much anything. I mean, they can put this on blotter paper, they can put it into candy bars, they can put it into energy drinks. This is very hard to just look at something and know if there's a synthetic drug inside of it. I think the biggest thing is when you're around someone that you know and their behavior is just bizarre. Most of the people we deal with, we end up coming on scene, and usually the parents or a girlfriend or a roommate just tells us that, hey, they showed up and this is what they're acting like. They've never ever been like this before. That's a huge red flag. But a lot of it might be they might be perspiring. They might be derobing, taking their clothes off. A lot of times we've ended up coming on scene and someone's naked because they've taken all their clothes off. Cyclic behavior, where they just repetitive, they keep doing the same thing over and over, and also repetitive speech is very big. Let's say, for example, your kid should come home and they have this bizarre behavior. I would never want anyone to not report this with the fear that the police are going to take them away or whatever. I think our main concern is to get them medical help. In fact, every call that I've been on in the last couple months to do with the synthetic drugs and possible overdose, I mean, I'm concerned about that person's welfare and well-being. So we get the ambulance service over and have them transported to the emergency room immediately. And I would say it's more a concern for me to find out where this come from. And are we going to go after someone who is giving your child this particular drug or something like that? And I would have to say the answer to that would be yes.